And according to physicians, older adults with COVID-19, you've probably heard this, are experiencing irregular symptoms, complicating efforts to ensure that they get the appropriate treatment.
But older adults, the age group most at risk of severe complications or death from the condition, may not have normal symptoms. Joining us now is Associate Dean of Clinical Affairs, College of Medicine, University of Illinois, Dr. Heather Prendergast. Welcome to the show.
Thank you for having me.
No, thank you for joining us, doctor. And please tell us about the difference in symptoms that older folks and how old is older might be experiencing.
Okay, so as the body ages, so does the immune system. And so the traditional symptoms that we look for with coronavirus, such as fever, cough, shortness of breath, well, in the elderly, you're not likely to see these symptoms. In fact, they're more likely to present with what we call atypical symptoms. So instead of the fever, they may present with things such as loss of appetite. For some reason, mom, dad, grandma just stops eating. They have weakness, dizziness, increased fatigue, frequent falling, even passing out. And so it really makes it, you have to have a heightened sense of suspicion, right? And so I think one of the things that always sets off an alarm in my mind is when a family member says, you know, something just seems off. They just don't seem right. I think if you notice this is the time to get your parent or loved one in front of a provider where they can have testing done.
What if they fear going to emergency rooms or doctors because of the COVID-19, not wanting to get it? Sometimes, you know, older folks can be a little bit stubborn about going to the hospital or to see doctors. What do you recommend there?
So, you know what, actually, this is something that I think we need to kind of get the message out that actually the emergency departments are very safe. And we know that as across the country, we've moved to universal masking. So we're doing everything to protect patients. So no longer will you see waiting rooms with patients sitting right next to each other. So patients are taken right back, and everyone has on a mask for source control. In addition, we know that in seniors, their reserves are a lot less. And so they can quickly deteriorate. And so we want to, as soon as you notice that something may not be right, it's best to bring them in to get them tested. And so we have ways of separating COVID-19 or suspected patients from those that have it. So actually, the emergency departments are actually a very safe place to bring your loved one, especially if you're concerned. If you have that suspicion, bring them in.
Well, these are the folks at home, doctor, but what about the folks who are in senior care facilities, in nursing homes? They are the hottest of the hot spots today, and family members can't really get in to see about their folks. What advice do you have in that instance?
I think that you have to definitely be a strong advocate. I know these visitor restriction policies is making it difficult, but now that there's a growing awareness that that nursing homes are, or long-term care facilities are hot spots, more and more legislation is being passed or recommendations from CMS. Now nursing homes are required to notify families as well as the CDC if they have 3 or more residents that are having any kind of respiratory symptoms. They have to disclose whether or not they're COVID-19 positive cases at the facility, as well as any deaths. And so opening up and getting a little bit more transparency will help, but I think we have to be strong advocates for our seniors, particularly in this time, and we have to demand that there is PPE for workers, because I think that's one of the strongest messages that I can make, is that we have to protect our seniors. We have to, you know, make sure that we are guarding their environment, even if they're in a long-term care facility.
Wonderful information. Thank you so much for joining us tonight, Doctor.
Thank you for having me.